Alcee Hastings from Florida.
Thanks for being here.
I'm glad that we have new Floridians here because the Affordable Care and Patient Protection Act is already helping millions of families and seniors in Florida and all across this country. As the Republican majority works to repeal these important consumer protections that the health care law provides, today I'm offering an amendment. Americans will not lose these critical protections created by the Affordable Care Act that ends insurance company discrimination based upon a pre-existing condition. Because as you are aware, the Affordable Care Act outlawed the worst abuses by the health insurance industry, and it instituted these vital consumer protections for families and individuals. Specifically, the new health care law says that insurance companies cannot refuse coverage or certain medical services because someone has cancer, or they have diabetes, or they have asthma, or they have some other grave diagnosis. This is the bedrock of our patient Bill of Rights, ending insurance company discrimination of citizens with pre-existing medical conditions. And we throw that term out a lot, don't we? Pre-existing medical condition. But if you all would pause and think for a moment of a family member, a neighbor, someone that you go to church with that has cancer, that has HIV, that has received a diagnosis maybe in the past few weeks, maybe that has had cancer and is in remission, but has struggled with those insurance companies to try to get the medical care that they need. In my hometown, I think of a woman I met that works at the community college named Sharon Williams. Sharon was diagnosed with breast cancer at the age of 21. And upon that diagnosis, she went down the list of covered health services and diagnosis for her health insurance. And you know what? Breast cancer wasn't on it. It wasn't on the list, even though she had insurance. She said after her diagnosis, they showed me a list of different types of diseases that the health insurance company covered, but there was no breast cancer. And I remember becoming really, really angry. And I said, look, I have something growing inside of me that's going to kill me. Somebody help me. She went home, closed her blinds, and cried herself to sleep. She felt hopeless with nowhere to turn. She didn't eat and was only a step away from throwing in the towel. She said no one would cover me. She went uncovered with health insurance for 10 years after that breast cancer diagnosis. She fought through it, and she's in remission now. But she said she felt like damaged goods. And she looked for another plan to cover her, but there was no plan out there that would cover her. She became more frightened of not having insurance coverage than the cancer. But after the passage of the Affordable Care Act, Sharon cheered. We were together a few days after President Obama signed the Affordable Care Act into law, and she said in front of a lot of TV cameras, this health care reform bill is very, very important. It's dear to my heart because I have a pre-existing condition, and there are millions of people out there all across America that have pre-existing conditions that are being denied even as we speak. And it's just not right. And you know, there are also thousands of children, of American children who are childhood cancer survivors, or they have other conditions, who now have insurance coverage because of the Affordable Care Act. And I ask you all, don't repeal it. Don't take away their insurance coverage now. Our new law has now outlawed the discrimination the health insurance companies had instituted based upon the kids having cancer or asthma or diabetes. One is a student that attends the Florida who was dropped after she had AML leukemia. She lives on her own and completely supports herself. So she said to me, of course I panicked after her diagnosis. With me going to the oncologist for my blood work and checkups, I could be charged a ton for co-pays and out-of-pocket costs. With me being dropped, I feared that I wouldn't be able to find another insurance company to pick me up. But thanks to the new law, my mother's health insurance has accepted me, even with my cancer being a pre-existing condition. Another student, college student in Florida, Sarah Woodbury, says, I'm a leukemia survivor, a daughter, a student, and a citizen of the United States of America, and I have multiple checkups to make sure I stay free from cancer. And because I have several lasting medical conditions from my cancer treatment, my mother was denied several times of insurance for me when she tried to switch. And the quotes they did give her to cover me were impossible to afford. But now, with our new law, she said, I'm very glad to hear that child survivors of cancer are given a chance to stay covered by insurance regardless of their medical history. No person who has fought or is fighting cancer should be denied anything simply because of the cancer. Cancer takes so much from so many undeserving people. Why should insurance companies have the right to deny them insurance or a chance at an affordable plan? After all, no child asked to be plagued by cancer. So committee members, before the Democratic-led Congress passed and President Obama signed the Affordable Care Act last year, if you had a cancer diagnosis or you were in remission or you have a heart condition, believe it or not, if you had been a victim of domestic violence in 8 states, some insurance companies called that a pre-existing condition. If you had any of those conditions, you were often denied care. Well, we finally changed that. And I implore this Republican majority, don't go back. Don't repeal these important consumer protections. Our children shouldn't be penalized because they were born with a heart condition or leukemia. They need access to the very best doctors and the very best care, and that's what the Affordable Care Act does for our children and will soon do for all adults. Mr. Chairman, there are people like this all across America. I'm certain you know many of them back home in your district. We need to maintain this vital protection, these vital protections created by the Act. If you repeal the Affordable Care Act, you will be sanctioning that type of discrimination again. If you repeal the Affordable Care Act, you will add to the instability of the workforce. Just when we've given them an economic lifeline, you will snatch it away through repeal of the Affordable Care Act. If you repeal the Affordable Care Act, you will explode the deficit. Now we know to the tune of $230 billion. If you repeal the Affordable Care Act, you will demonstrate an affinity to the health insurance companies over the interests of the American people and our families. So I urge you to support this amendment that bars insurance company discrimination of people with pre-existing medical conditions. Thank you very much.
Thank you very much.